Debbie, I'm Dr. Melton. Pleased to meet you. How many years have you had a denture?
It's almost 3 years.
Almost 3 years. Okay, did you get your denture here?
Yes, I did.
Okay, all right. So you had teeth, major dental problems,
Yes,
probably.
yes.
But on your lower teeth, you look like you're in pretty good shape. With the exception of a little thing here, a little restoration there, they look quite good. Okay, so tell me how you like your denture. Do you like the way it looks?
So far, it's okay for me. Like, you mean the shape?
Yeah. Do you think it's attractive? Do you like the color of the teeth and the arrangement of the teeth? Or do you have difficulty eating with it?
I like the shape. I like the color. But the only thing I don't like is uncomfortable when you're talking or when you're eating.
Okay.
Yeah.
All right.
Yeah, or you want to play something harder, you cannot play.
You cannot do that.
Yeah.
Does it give you a feeling of insecurity that it might fall out?
Yeah.
Okay. And what do you do? What type of work do you do?
I'm a ceramics.
You're a dental ceramist. Okay. So you spend every day, all day making pretty teeth for other people.
Yeah.
Okay. Think it's your turn then?
I hope so.
Okay. Now, would you have strong feelings about having another denture made that might be more attractive? Would that satisfy your needs, or would you want it? Do you want it to be something that's more stable and fixed in your mouth? There's something that you might not take out, but once or twice a day to clean and take care of. You have a pretty smile. What I like about your smile is your upper lip. It has very slight concavity to it. Okay, very slight concavity, and in doing so, when you smile and you have a beautiful smile, you show very little of the tops of the teeth. You show very little soft tissue. Now, my question is, how much longer can your upper front teeth be? What would be the maximum length of your upper front teeth, the two centrals, to give you an ideal smile? Okay, maybe it looks a little bit less worn, and I think we're going to have to work that out. And the things we're going to do is have you hold a mirror, and I'm going to take some teeth, some denture teeth, and we're going to put them in a wax rim, and we're going to kind of move them around a little bit and try to reestablish your midline and where we want your incisal edge position to be and where you need support and where you don't need support, and it will become a mock for the final result, so that ultimately when we make the restoration, whether it's a complete denture or it's an implant supported denture or all ceramic restoration, then we know that the teeth are in the right place, that they look like you, they function like you want them to function, you sound like you, and there's something that makes you really want to smile. Okay? So that we're going to have to work out. But otherwise it's guesswork. Okay? Debbie, I'm looking at your health history. I see. How long have you been working here? Doesn't say that.
Almost 10 years.
Almost 10 years. Okay. Very cool. I don't see anything about your health history that excites me at all. In fact, it's no to everything except are you anxious? And it says here, very anxious. Okay. How do you feel about anesthesia? Very anxious. So that means we need to be nice to you? Huh? Okay. All right. Well, we're not going to be dealing with anesthetics for a while, but it looks like you have no major issues. Okay. All right. And live close by. Married. Children?
Yes.
How many?
Two kids.
How?
Girls.
2 girls.
Yes.
How old?
My first one is 14, and my second one is 9.
Getting to be big girls.
Yeah.
Okay. So it's time for Mom to do something for herself?
Yeah.
Okay. Got it. Okay. As I look through the rest of the history, I don't see anything at all that jumps out at me. You look very healthy. Anything that's happened to you that I might need to know of since you signed this in late 2009? Nothing's changed?
Nothing changed.
Okay. Nothing's changed except you'd like to get these teeth done. I'm looking at the colors of the tissues. I'm looking at the volume and quality of the soft tissues. When I say volume, I'm looking at them architecturally. I want to be able to put my finger back here. I want to see how close the tuberosity is to the ramus, because I know when she chews, her ramus comes way over and almost bumps that, so that's going to affect the thickness of the denture. I want to know what the saliva feels like, and if it's real sticky, that's not good. If it's dry, that's not good. And most of the saliva I feel is nice and thin and serous, and it ought to work real well towards retaining a denture. The ridge width coming forward is nice and wide. From about her premolar or first molar area through the premolars is nice and wide. Then obviously we have an incisive papillae, dead center. Can you see that? Okay. Now that's a terribly important landmark, because we know that her front teeth, if I put a point right here in the middle of the incisive papillae, we could measure 10 millimeters forward and it would be almost dead center to the fronts of those teeth. Now, there are some people that report this number being 12, but they talk about it being from the back or the distal of the papillae to the incisal plane. So that gives us a lot of information in a hurry. Now, another thing we're looking at, if we're looking at crown and bridge work, is we've got to look and see how wide the ridge is and how it drops down. Because if this is too long, then it makes for a very gummy smile, where you have small teeth and lots of gum showing. If we were doing this case as an all-on-4 case, then when the single most important part here would be determining where her high smile line would be, and then making sure that there wasn't bone below that level, and that we would be able to have a transitional position that would be above that high smile line. Okay? The worst possible thing for trying to do individual crowns and bridges and all in here is to have too much bone. And that would be contrary to what most people would think would be important. Too much bone can be a much bigger problem. So the thickness of the bone, the position, the quality of the tissue, at least through premolar to premolar, looks very, very nice. We'll have to look at panoramic films and maybe cone beam to get a little better look at what that is. Now just lick your lips. Okay, just lick your lips and just let them lightly touch. And let your face totally relax. Okay, now you can tell she's not lost much bone, because without a denture, she still has an attractive lip. Okay, that tells me we've got to be careful on how much thickness we use when we go back to the final product. But it also tells me she is an excellent candidate for having implant-supported fixed bridge work, the ceramic version of it. So that what she would like to have, she can probably have, and it would really be attractive and ideal. Okay. Now, I'm going to put this back in your mouth, and then we're going to look at a couple of other things that go with this. All right. Now, I want you to lick your lips again, okay? And I should have you standing up, but this will work okay. And just barely part your lips. Just barely part. Barely part. Okay. Now, when she does that, do you see her incisors? It's difficult, isn't it? They're a little bit short. I'm having to kind of work them down. Their midline, turn towards me a little bit, looks like it might be slightly off, but not a lot. They tilt a little bit forward, and the whole process is a little upward in her mouth. And so I'm thinking for a person as young as she is, that we're going to want to show some more teeth. You know, we want to show that her teeth aren't worn, they aren't old, her face isn't collapsed. We want them to be within harmony of her face, but we want them to show the display that's appropriate for her, and when she smiles, they have a little twinkle to them, and she looks like a great person her age. Okay. Next thing we're going to have to do is determine the colors of the teeth and the shape and arrangement of the teeth, and some of that's trial and error too. So when we begin making impressions of your mouth and doing what we call diagnostic casts, we're going to have a copy of your lower jaw and a copy of your upper denture and then a copy of your upper edentulous base, all mounted on one instrument we call an articulator, so that we can see how they are arranged in space and get a good idea as to where and how we're going to go about idealizing the restoration. Okay? And obviously she has a lot to say about this. Sometimes when we're involved with aesthetic issues, we do it by committee. And the committee right now in the room are the three of us. You may have a mom, a husband, a sister, or someone else that you'd like to have involved when we start doing these things that are aesthetic, because aesthetics begins to leave the world of science and is really an issue of art. Okay? Art, functional art. Okay? So we've got to work all of that out. This is just what I would do for you, you know, if I had an open book and could do all of these things, I might please you tremendously, or I might do some things that you just hate. So we've got to do them together. Okay? All right. Now, I've noticed from our diagnostic cast that we have a plane of occlusion on your right side where you have some teeth that are moved. We have an upper molar that's super erupted out of the dental arch, and we have two premolars that are below the plane of occlusion. On the left side, this dental arch, what we call plane of occlusion or curve of Spee, is nice and gradual and appropriate. Okay, it's nice to work with. Sometimes people have this plane of occlusion on the back part of their mouths, and they have lower front teeth that are either worn forward or they have super erupted upward, and that causes us problems to issue also. Now it looks like you've got a little bridge, and we're dealing with the lower lip, okay, in which you show very little lower teeth. All right. And so your upper teeth are going to have to dominate the smile. If we make your upper where you show the same amount of tooth you do on your lowers, then when you close, you're going to look older, overclosed, and older than you are. Okay? So we get to get real creative with your upper front teeth. And in order to do that, we're going to spend time working on sounds like F's and S's and T's and V's and things like that. So where lip support and tongue and cheeks and all of this comes together to determine exactly how your teeth should be arranged in space, so that they're pretty and they're phonetically correct and they're functionally correct. And that's going to be one of the very first things we do. Okay? Now, as we start to go about doing things for you clinically, we'll make impressions, we'll take wax rims on base plates, and we'll determine how much lip support you need or how much you don't need. Okay? And looking at your denture and your ridges right now, I suspect we're almost going to be setting teeth almost to your ridge instead of a base plate, because you haven't lost this bone. And that's a great thing. When patients have bone, they have wonderful treatment options. As you lose bone, you rapidly lose those options. Okay? So we're going to mock this up. It's going to be like an architectural model of the final result, and then we're going to go with that. And then the denture, the new denture we'll make for you, you'll get to wear and make sure that it's appropriate, and then we'll use that denture to mock up the final restoration that will be done. Everything starts with what we gather right now, and keeping this beautiful face and just adding in more attractive teeth. Okay? And it might take us a little while to get that done. Not going to be a one-appointment deal. Well, here's some of the issues that we've talked about, in the last 30 minutes or so that are going to be important to you. I think probably one of the most important parts of this is for you to feel like that you're participating in this, not in a film or anything else, but we're working together in team to give you the result that you want. Sometimes it's easy, sometimes it's not. Sometimes in order to get the best result, we even have to backtrack sometimes. If we make impressions that aren't perfect and we need perfection, then sometimes we do them over. You know what it is to work on teeth. The technician has to have something that's as ideal as possible to work with, and it's my job to really work for the technician, I think. Work for you, work for the technician. And then I get to go along with the ride and enjoy the result. We've looked at your teeth, okay, as they exist. I think I have some ideas as to where to go Okay? And what that's going to mean is I'm going to have to create for you a new mock or trial denture that would give you either a more appropriate or better denture, or it will be the mock for doing the crown and bridge on implants that you really would like to have. And the way we're going to go about it is the same way you had the first denture made. We're going to make impressions. We're going to pour stone casts. We will make a base plate and a bite rim, and then I'm going to trim it. I'm going to put it in the mouth, and where we've overextended it, I'll have to cut it back and get it thin. We will determine the midline, the incisal ledge position, where the canines should be, how low, the arch form, all of those things. We took the preliminary impressions back to the lab and we poured some alginate casts. And to kind of move this on, we very quickly made a base plate with a wax rim on it. And we did it to somewhat arbitrary way, okay? Because I'm going to use this in your mouth to capture your midline, where your teeth belong, your vertical dimension of occlusion, okay? And then we're going to put adhesive in this and actually use a medium viscosity impression material, and to take a final impression, a perfect impression, at the exact height and vertical dimension that we want to restore to. Okay? All right. And if we have a minute or two, maybe I'll put the two front teeth in. And then it'll go back to the laboratory. Technician will mount the cast and begin to set the teeth to where we think they should be ideally. And then we'll try them in, and that will be a dress rehearsal. You'll get to approve them. You can say, I like these, no, I don't like these. And I'm going to say, what is it you don't like about it? And you're going to say, I don't like the color. I don't like that tooth. I don't like the shapes of those teeth. They don't show enough. They show too much. My lip's too full. All of those things that you're readily going to have to criticize what I create for you. Okay? Otherwise, I don't know how to make them the way you want me to. All right?
Yeah.
A deal? Okay. I'm going to put this in. It's not going to fit well at all. You're not going to like it. Okay, and I'm going to push up on you. Okay, now I want you to just close. Just close. And stop right there. Close, stop. Let me look at your lips. Look at that. Swallow. It's beautiful. You have beautiful lips. Okay, a little bit full right here. A little puffy. Okay, but let me see. Don't open. Let me peek. Okay. That is so good. I'm not even going to have to fool with the base plate yet. Open. And it's pretty darn tight. So it shows we're in the neighborhood. Then what I'm going to do is I'm going to score this a little bit more. Now gently close right where you closed. Okay. Let your lips come together. Swallow. Pretty? Okay. Maybe a slightly bit open. Maybe a little bit. We'll work with that. But look how nice and smooth that is. It's very pretty. You still have... Okay. Now, what I'm looking at, though, that material set really, really fast. Let's go ahead and let me put a midline to it. And I'm going to look straight at you. You just look straight up at me. Now, let's determine, as thick as this is, her lip is going to drape a little further downward. But go ahead. Right. Just let your lip relax. Completely relax. Okay. Take that, yeah. All right. Is that level? Home run. Just seconds. I'll trim this up a little bit later. Ready? Good to go? Okay, now open for me. All right. All right. All right. Okay. Okay. Now that we've separated the guidance system, let me dry this off. We're going to put a little adhesive on it. We're going to take the final impression, and we're going to do a closed mouth impression so that we will be making the impression at her occlusal vertical dimension. Now I'm going to overdo this a little bit, okay? You're going to feel a little bit flow out. I'm going to trace out the perimeter so that it flows over. Okay. I got it. Open for me. I'm going to push high. Okay. I'm going to push kind of hard. You okay? I'm going to hold it with my other hand. I want you to just close back to where you did. Perfect. A little bit of pressure, not much. Okay? You doing all right? Now I'm gonna give you a massage. You get a lip massage when you come see old Dr. Melton. Okay, I'm gonna watch when this starts getting sticky. I'm gonna have you open your mouth, and then I want you to open and close and go swing and go wide. Okay? And I best not mess up any of our landmarks. Okay, now keep your teeth together and do this. Okay, both sides. Okay, now open for me. Now you can really get with it. Move your jaw side to side. I know I get your finger in here. Go, like this. Go. Oh yeah. Okay. Okay. Now, kind of do the same thing you would with your lips. You're trying to get lipstick off your lips. Yeah, out of way. Out of way. Down here too. Okay. Close down again. Close. And just. Okay. All right. This won't take long. Now you just rest right there. And I should have a really good impression with this. Sometimes I miss a little area, I just add a little bit back to it and we put it back in. Okay? Good. Now, if in group, if there was a committee looking at you, they would say, I've opened your vertical dimension ever so slightly. You're a little bit further apart than you were when we started. So we got to keep that in mind because we got two dimensions we're working at. Number one, when your jaw's at rest, if I put a dot right here and put a dot right here, and I had you lick your lips and just let your lips touch, and you would just, when you swallow, you would relax, that would be your vertical dimension at rest. Now, when you're chewing and swallowing, there needs to be some room from where your jaw is at rest to the point that it closes up to where your teeth meet and you begin to chew. Okay? There's got to be a little space there. Because if it's not, if your teeth are touching all the time, when your lips are under this much strain, that means you would have no rest position and you would continue to grit and bite and your jaws would get sore and you may even have headaches from it, okay? So what we'll do is we'll close it down a little bit and find out exactly where that should be. You have to have enough room so that your jaw can move forward and back and your lips can move in conjunction with them and, you know, make the sounds that you make for words and stuff like that. Okay? Okay. Open. Let me just close a little bit. So, what do we have right now? We have a final maxillary edentulous impression made accurately, fit well. Okay. We have lip support. We have muscle attachments registered. We know where your incisal edge should be. We know where your midline should be. We've even taken the little bite stick process and we've added it a minute ago. Okay? I'm not going to force these back to place, but we know exactly where vertical is and horizontal, so that it can be set on an articulator, and it'll keep the technicians from getting confused with the cant of the teeth. Okay. And what we could have done is, before we did the wash, we could have put the 2 centrals in here. Now, that wouldn't have taken any time at all. Okay. And part of the reason I didn't do that is I didn't particularly care for the mold of teeth that we had to do that with. But if I had thought a little more, I would have gone ahead and used them, because I could always change them out in the lab. What setting the 2 teeth do is it shows the technician exactly where the incisal edge should be, exactly where the midline should be, and it also shows the cant of the teeth. And that's a really important thing to do. So what we'll probably do as we move on in this, we may just backtrack and get that. Okay? Nevertheless, we have a well-made alginate impression of your lower. You've got a good diagnostic cast. I like to pour them in die stone so that they're almost unabradable. Okay, we put them in a nice articulator that has the ability to adjust the occlusal vertical dimension, open the guide pin. Okay, and it has a really good centric latch to it. You know, so we can disassemble them if we want to. In addition to that, it's semi-automatic, so it pretty well fits the anatomical numbers that are consistent for almost everybody in this room within just a few millimeters. So it's a really good way to do this without going into crazy difficulties that add very little, if any, to the final result. Okay. Next step will be try-in. We'll make sure we got the perfect denture. Perfect in the sense that it looks like you want to look. Okay. And all our geometries are correct. Haven't seen you in a week. Okay. Go ahead and take that denture out. I've got a new denture for you. Now, we just made this in a temporary base plate with wax. We put the new teeth in, and the new teeth might be perfect or they may be totally wrong. Okay? And who makes that decision? You. Okay? All right, so I'm going to put this to place. I want to make sure it goes to place. No, do this for you. Wiggle. Does it hurt any place? Doesn't hurt? Reasonably comfortable? A little bit? Okay. All right. Now let's close. Okay. Among the very first things I'm looking at is I want to make sure we're dead on occlusally, so that there's no slipping or sliding. And when she closes her lips together, go ahead. If I'm going. Okay. Look. Pretty face. Beautiful lips. Comfortable. Doesn't look like she's got a worry in the world. Okay, that's the way it's supposed to be. There's enough curve to her underlip. This may be a little bit bulky here. Always better to have too much than too little, because I can always take it off and it acts stable. Okay, can you swallow? Pretty comfortable? Okay, all right. Now lick your lips. How you doing?
Good.
Good? Okay, well, show me your smile. Is that not a great smile? What I like about it, it's got a classic gull wing design. The 2 centrals, dominator smile. The shapes of the teeth and the way they're positioned, I think they're really attractive in her face. I like the way the little lateral here is set differently than the lateral there. I got a little more of a canine jutting out a little bit here than I do over there. I have a well-supported upper lip without it being too bulky, too thick. Okay? And if you look at it, the gull wing, the arrangement of her teeth just complement her lower lip. I think that's a nice look. Take a peek. It's your choice. What do you think?
You asking about the outside or the feeling?
Of the inside?
Yeah.
It's all right. If you were making you a new complete denture and that was the end result, then I would have to be concerned about the borders and how tight and retentive it is.
Yeah,
okay.
Yeah.
Right now, because we're going to implant supported bridge work with you, I'm more concerned about facial contours, smile line, your comfort with yourself. Your bite's not going to be just right because this hasn't been fixed yet.
Yeah.
Okay. But it's a really, really good starting place if you like it. I've had people come in and look at what I've done for them at this stage. They looked in a mirror and said, that's just not me. I haven't looked like that in 50 years. I want the teeth to be flatter. I don't want them to be as pretty. I don't want as big a transition. There are other people that come in and say, no, I want them stark white. I want my teeth to look so youthful that they don't look like anyone's teeth. Okay? So beauty is in the eye of the beholder.
The only thing I don't like it is I feel so uncomfortable right here.
Okay, I can fix that.
Okay.
Slip it out. Slip it out for me. All right, see where all these flanges are? If you had to have a big flange to hold your lips up, it would worry me about doing this in crown and bridge work. When you say this is too much flange, it tells me you have enough bone that we can do an implant restoration. Frequently, if I'm going to do an implant restoration, I take these flanges off and I set the teeth on tin foil so that the wax it abuts immediately into the ridge. Okay? All right. And before we get all done, before we move to the next levels, that's what we will do. We'll make sure that this flange, no flange is required to give you the lip support that's natural. Okay? Because you don't want the other effect either. You don't want to look depressed. You don't want to look like your lips fall in. Okay? Now, I'm arbitrarily taking this flange off because it overfilled her vestibule. And you can almost see with the way the technician shaped it that he knows that they're too thick there. Let's try this. Can I put it in? That-a-way. Make that motion. Better? Okay. If I can't get that right for you, you're going to have to grow a mustache. It's the only way to hide those things. What do you think?
I feel look like the canine is not right.
All right, let me see. Look at me. All right, because this one, do you like the left canine better than you do the right canine? Which of the two canines you like better?
I think this one better.
Yes, this one comes out. The backside of this one flares out that much, too much. Let me see if I can change it. If you look at the bite here, see how this drops down into where that space is? And if you look at the wax here, they put these in, and it's kind of forced the canine out. Probably what we should do is to finish bonding and getting that before we do the final dress rehearsal. In which case, if we have them bonded, I can soften the wax, raise them up, and I can take the canine and bring it back more into alignment like that one is. See, this is your good one. This one's a little too full.
Yeah.
Okay. Can you say Mississippi?
Mississippi.
Can you say Kansas City?
Kansas City.
Kansas City. I want to hear your S's. Kansas.
Kansas
City.
City.
All right, now I'm going to give you some Texan. I don't know if you speak Texan. But in New Mexico, if you want to have dinner, you have to be able to say green chili chicken enchilada. Can you do that? Green chili.
They're coming down.
They're coming down?
Yeah.
Okay, we may have to stick them up then. Do the best you can. Green chili.
Green chili.
Chicken.
Chicken.
Enchilada.
Enchilada.
Not bad. Okay, green chili chicken enchilada. Okay. Now in Texas, if you want to have dinner, you have to order a chicken fried steak. Can you say chicken fried steak?
Chicken fried steak.
Pretty clear. Pretty clear. Now, those words, that menu is probably not real normal to you, but it kind of tells me that your teeth are in the right place for you to be able to make those sounds as clearly as you have. So I think this is a great starting place. Good morning to you.
Good morning, doctor.
I think we're going to try with Debbie today. We're going to do that, hopefully that last little fine-tuned try-in before we move forward to completing the rest of all of the implant reconstructive dentistry that we're going to do. But this is the lady that gets to judge whether we're ready or not ready. So I'm going to put this in place. I'm going to put a little bit of Fix-It-In on it. Debbie's going to remove hers, and she's going to carefully put this to place because she knows exactly how to do it. And then we're going to hand Debbie the hand mirror again, and she's going to get to look at herself. And we've altered the arrangement a little bit, and so we're going to hopefully do one last try-in. And there's a couple little things that I'm concerned about, and she's going to look and see if there's anything she's concerned about, and then we're going to fix it, and we're going to get going. She obviously has some things that she's focused on and really wants to know are the way she wants them done. And then, of course, there's some things I'm focused on. I'm focused on how much available space we have, where are the teeth located, where can we put implants and put them beneath the dental units in such a way that they look real and they're hygienic and cleansable and have the possibility of lasting here many, many years, if not indefinitely. You know, I think this is not a short-term plan. This is something that will hopefully last her all her life, or at least the foundational part of all of this. So this is a really important thing. It's important from a communication perspective, from us to the laboratory, the technicians that are going to be required to make the restorations, okay, and do it in a way that pleases both of us. But we got to start with Debbie, and she's got to look at it and see, does she like the appearance of the teeth? Now, her speech is going to sound a little strange to her, probably less so to us, but you know, we all have in our minds, in our brains, kind of how we think we sound. And when she makes a change like that, even though it's a subtle change, it's going to make her kind of think that she sounds maybe differently than she really does. Anyhow, we'll have to deal with those issues, but the phonetic part of this, as well as the aesthetic and functional part, is really, really important. Okay, can't go around life not sounding like who you want to be and who you think you are. Okay, kiddo, take a look. Now, some things I would want you to focus on, of course, is lip support and how much tooth you show. I want you to focus on the midline. Is the midline right where you'd like it to be? Because if there were 10 people in that chair, 10 people would all think their midline might be in slightly different places. So that's going to be important, particularly important in the final result. If it's a smidge off one way or the other, it's not catastrophic at this point in time. But in the final, it has to be where she wants it to be.
I like it.
Do you? You're pretty. Gorgeous smile. Now all we got to do is replicate that with beautiful ceramic and everything, and who knows, maybe you'll end up on the cover of a magazine. Okay. All right. Now let me take a peek. All right. Now check your midline, because the midline to me needs to move a smidge to your left.
My left?
Uh-huh. You okay with it?
I'm okay with it.
Then let's go.
Yeah.
All right? Let's go. You're not from Texas, I don't think. But in Texas, if you want to know whether your F's and S's and your sounds are good, you have to be able to say chicken fried steak. Can you say that? Do you even know what a chicken fried steak is? That's the favorite food of Texans. Okay.
You want me to say chicken fried steak?
Yeah, I want you to say it, and you said it pretty well. Okay. Can you say Southern California? Can you say green chili chicken enchilada?
Green chili chicken
Enchilada.
enchilada.
It's not going to be anything harder to say than those two things. So, do you have any favorite things that you would like to say to make sure that your speech is like you want it to be?
I don't know.
Okay. So, can you count, let's say from 40 to 50?
40, 41, 42, 43, 44, 45, 46,
Okay.
47.
Perfect. Now, count. Let's start from 60. Let's start at 60 to 70. That's harder.
60, 61, 62, 63, 64.
You're on the money.
65.
Okay. When I look at your teeth, and instead of looking in your eyes, I'm looking at your teeth, I see that your lower teeth and your upper teeth just barely miss when you say S's. And that's the way it's supposed to be. In textbooks, that's referred to as closest speaking space. It's the closest the teeth come without actually touching. Okay. And to my ear, you're real clear. Okay. All right. Now let me look at you straight on. Smile really wide. Okay. Now the teeth posteriorly line up almost edge to edge. She's her buccal corners. To me, there could be a little bit more white, a little wider. But a major consideration we have is where the bone is and how we're going to place implants so the restorations die into the abutments in a way that is attractive but also very hygienic. And so this is probably the best arrangement for the positioning of the implants in the posterior part of her mouth. And if it pleases her, then we're a go. Okay?